Kim Kardashian recently announced she was diagnosed with a brain aneurysm. Here to explain her condition, Dr. Sunil Jeswani with Sharp Grossmont Hospital. Good morning and thank you for being here.
Good morning. Thanks for having me.
Things like this, when they happen to people who are well known and celebrities, gets everybody talking. And let's start off by just talking about what is a brain aneurysm.
Yeah, so in the brain, you have multiple arteries that run up through the neck and eventually branch off into multiple small arteries and feed blood to the brain. And if you think of an aneurysm as like a rubber tubing, sometimes what happens is that the wall of the rubber tubing can become weak over time, and then it can start to balloon out. That ballooning out of that wall is an aneurysm. As the balloon starts to expand, or the aneurysm starts to expand, and the wall continues to weaken, it can eventually rupture, causing catastrophic hemorrhage in the brain.
I read somewhere that it's actually quite common, more common than we think, for people to have a brain aneurysm, and that most people won't even know.
Yeah, it's about a little over 3% of the general population. Oftentimes, they won't even know they have it. It'll be found many times just at autopsy after a patient has died.
What would cause this to happen? Are there things that people are doing in lifestyle that would be causing this?
Yeah, there's a few known risk factors that are associated with an aneurysm. For the large part, there's not any known risk factors in most people. Some people have genetic conditions that can predispose them to developing an aneurysm, like connective tissue diseases, or polycystic kidney disease. Some people, if they have a family history of aneurysm, meaning it's someone in their immediate family, mother, father, brother, sister, that increases their chance of having an aneurysm by 9%. Smoking has been known to be associated with the increased risk of aneurysm and the aneurysm rupturing. High blood pressure has been associated with the development and possible rupture of aneurysms as well.
I believe I heard when Kim Kardashian said something about stress that could have been the reason. Is stress a big factor in this?
Not that we know per se. It's possible that one can say, well, if stress can lead to high blood pressure problems over time, then that could be possibly associated with the development of aneurysm, but there's no known direct link that I know of between stress and aneurysm formation.
You just said that most people will find out that they even had this. They wouldn't find out because it's unfortunately found out in an autopsy. Would there be any symptoms or any moments that if somebody's watching right now, they would think, oh my goodness, I should go get this checked out? And can a doctor be able to even identify that somebody has this if they went in earlier to get it checked out?
Yeah. For most people throughout their lifetime, if they have an aneurysm, it will go unnoticed until the moment it ruptures.
Wow.
If it ever does rupture. And when it does rupture, the classic symptoms are sudden, severe, instantaneous, what patients describe as the worst headache of my life. About 20 to 25% of patients won't even survive making it to the hospital if the aneurysm ruptures. Of the ones that do, about a third of them are left significantly neurologically disabled. And like I said, there's oftentimes no warning signs before it ruptures, so it could be sitting in your head.
Yeah, not knowing, but what can people do? Is there anything anybody can do to find out if this is in their body?
Sometimes people will have some symptoms before it ruptures. They may start developing generalized headaches. They can start developing things like double vision or loss of vision in one eye. They can suddenly develop a mini headache that then goes away, and that we think is because the aneurysm has ruptured a little bit and then stopped. We call that a sentinel headache. These are all warning signs that there is an aneurysm brewing in the brain that may rupture soon.
Yeah, and headaches, like how many people get headaches on a regular basis and not to be able to know when is it time to, are there scans or anything that can identify?
The gold standard is to do what's called a diagnostic cerebral angiogram, in which they take a catheter, advance it through an artery in the groin, all the way up through past the heart, up the neck, and then inject the different arteries in the brain with dye to see it. There's some other less invasive or non-invasive tests that you can do, like an MR angiogram, which is a type of MRI, or a CT angiogram, which is a type of CT scan that can oftentimes detect these aneurysms as well.
Well, I mean, it's good to know and to have the conversation. So if you quite possibly feel like you may be concerned about this, you'll definitely reach out to your doctor. Dr. Sunil Jeswani, we appreciate your time. Thank you for being here.